Hi, Andy. This is Dr. Ravi Kiran, General Physician and Diabetologist, Onus Robotics Hospitals Incorporated. As a part of corporate social responsibility, I would like to discuss about fatty liver. Fatty liver is the most common metabolic syndrome that we are suffering from. Just because your LFT is normal doesn't mean that you have a normal liver. Let's get into detail. How many of you were told your liver tests are normal, but still have belly fat, diabetes, or high cholesterol? Today, I will show you why normal liver. Today, I will show you why the normal liver function test does not mean your liver is healthy. Always remember, especially in urban India, 1 in 3 adults have fatty liver, and most of the times they have normal LFT. Many discover only when it's too late and fibrosis has started. Let's know about the basics. What is LFT? LFT is liver function test. It usually measures SGOT, SGPT, bilirubin, alkaline phosphatase in all the places, and some places we also check albumin, globulin, and other proteins also. SGOT and SGPT refer to liver enzymes which are elevated when there is liver damage. At the same time, bilirubin also correlates with the liver function, and it denotes if there is any obstruction or any problem to the liver. Sadly, these are the damage markers and not fat markers. So for a fatty liver patient, if there is an elevation in LFT, it means that the damage is already begun. The big myth. The myth is if LFT is normal, liver is normal. The truth is fatty liver can exist for years with completely normal LFT. There may be mild aberrations in LFT which are considered as normal, and the patient is ignored for many years. And by the time they come with florid symptoms, it's already too late. Why LFT stays normal in fatty liver? This is the most important thing we have to know. Because always remember, fat deposition is silent and it happens gradually, chronically over so much time, and no immediate cell death is seen. Even if we have fatty deposition today, the cell death doesn't happen today. The fatty liver passes through many grades, where within the first 1/3 of the liver is involved, it's called grade 1 fatty liver. When then the 2/3 of the liver is involved, it's called grade 2 fatty liver, and when more than 2/3 or 66% or more is involved, it includes grade 3 fatty liver. So enzymes rise only when inflammation starts. Initially, there is a phase of steatosis where the fat gets deposited into the liver and the functions of the liver are partially deranged or partially slowed down. And by the time the inflammation starts, that's when the enzymes start rising. And many labs use outdated normal ranges where they put the normal ranges 40, 45, 50. But truly the normal value is less than 19 or less than 18. Who is at risk even with normal LFT? The high risk groups which we have to see ourselves are when a person has belly fat or visceral fat, which is a very dangerous part because it keeps on producing hormones. Patients living with diabetes or patients living with prediabetes, and in the abnormal lipid profile with high triglycerides, PCOS, which is seen in young females and females, high blood pressure, family history of metabolic disease, and sedentary lifestyle. Always observe these patterns. These all are present in people who are not caring for their health properly, or people who are suffering from fatty or metabolic syndrome. They suffer with these things: more belly fat, diabetes, high cholesterol values, high blood pressure. These all are interlinked and secondary to insulin resistance. The real cause: insulin resistance. Fatty liver is equal to metabolic disease and is not just a liver problem. The process is, whenever you have high insulin, liver stores excess glucose as fat or the form of triglycerides. These fat or triglycerides are accumulated in the liver. There is a state called as steatosis where the liver is filled with liver. Later, secondary to excess fat in the liver, the normal functions of the liver are deranged, and there would be a rise in inflammation of the liver. And then post-inflammation, there occurs fibrosis. How to properly screen for fatty liver? The correct screening includes ultrasound abdomen. This is the most easiest test and the most widely available test which is available throughout the country. It helps us grade fatty liver in grade 1, grade 2, and grade 3. Grade 1 fatty liver when the cholesterol is less than 30, deposition is less than 33%. Grade 2, 33 to 66. Grade 3, more than 66. Fibroscan is a more better scan, but it's less available. If you're able to get a fibroscan, that's good and better. That would help us know the extent and the severity of the disease. The next most important thing is waist circumference. A waist circumference of more than 90 centimeters for male and 80 centimeters for female is considered a high risk factor. At the same time, if fasting insulin is more, that is also a trigger factor. High triglycerides levels and high HOMA-IR. HOMA-IR is an advanced test which denotes the insulin resistance that is present in the human body. These all tests help us to know the proportion of insulin resistance and the severity of fatty liver a person is facing. Stages of fatty liver. The stages of fatty liver are fatty liver, simple steatosis in the initial stages, which is in the nomadic terms known as fatty liver. Next is NASH, non-alcoholic steatohepatitis, now also called as MAFLD, metabolic syndrome associated fatty liver disease. Next is fibrosis, followed by cirrhosis. Cirrhosis is an irreversible condition where there is going to be end-stage liver disease, where there's no coming up from this stage and the patient is going to succumb from liver failure. The most important question, can fatty liver be reversed? Yes, especially in early stages. In grade 1 or grade 2 fatty liver, there can be a majority of the patients who can be reversed of their fatty liver and can attain a normal lifestyle. The reversal requires, first and foremost thing is insulin resistance correction. Weight reduction of at least 5 to 10% of their body weight helps them attain fatty liver reversal. Carbohydrate control in the form of calorie restriction, strength training, sleep improvement, and stress management. These four form the core pillars. Diet changes, lifestyle changes, stress and sleep management. These are the cornerstone for all the complications of insulin resistance like BP, sugar, cholesterol, obesity, fatty liver, PCOS, etc. etc. You name a condition that arises from insulin resistance that can be treated by these four pillars. Do not wait for your liver test to become abnormal, because by the time the LFTs are abnormal, your liver has already suffered and it's become irreversible damage and there's no coming back. Book your liver risk assessment. We at Onus Robotics Hospital are providing fatty liver reversal programs where we help the people attain fatty liver reversal and lead a normal and healthy lifestyle. Apart from fatty liver reversal, we are also running diabetes reversal programs where we guide our patients to attain diabetes reversal and lead a medication-free life. This is Dr. P. Ravi Kiran, General Physician, Diabetologist, and Medical Director at Onus Robotics Hospital. Thank you.